radiologist, yeah.
Yeah.
Wait, now, but Todd is not to replace the one who died, is it?
No.
Okay.
R.H. Wallace. That was the time that Pat beat Chris. R.H. just retired
Oh, okay.
last year. And as the governor often does, he waits until the primary nominee is determined, and then they will appoint
Whoever won.
whoever won.
Yeah.
R.H. has been sitting up there as a visiting judge, officially
Yeah.
retired. Sometimes
I got a color viewfinder,
somebody else is-
and so I couldn't keep track. I got a color
Yeah.
Oh,
viewfinder.
I want you to talk, you have to go at least 10 miles away so we won't hear you.
Well, there's nothing going on. Oh, are you getting ready?
No, these folks are just sitting out here because they want to take a picture of the wall.
Well, I didn't see you sitting up there.
Lauren, are you here?
It's going to be Ariel and William Joy.
William. Who's Ariel? Ariel?
Here, did Josh, did he tell you about this?
So I just want to know, is Lauren not here because she might be someplace else?
She is,
He's at home.
She's at home. She has the new baby?
yes,
Okay, what'd she have?
a girl.
Well, please wish her the best and say how happy we are for her. So that's
Yes, we will.
I mean, for the last 6 months, we've been following Lauren and her baby. So now she's had
We've
it.
all been here every day.
Judge, if you want to say something to her, I'll send it to her.
Lauren, congratulations. We are so excited, and I know you're having so much fun with that new baby. This is great. And like we just told the group, basically we've been following you through this pregnancy as we've been going with COVID-19. Now, Lily, quit laughing over there. Yeah, well, you don't ever play poker. Your eyes will give you away. Congratulations again, Lauren. Okay, let's go.
Okay, you were very encouraging to the group yesterday that was protesting this closure of schools, and I want to get your reaction to the letter, the opinion from the Attorney General office today.
Well, how many people have said, well, the governor doesn't have that authority, and I'm just telling you, I've thought all along that he did. I'm good. I feel good about this because the folks who are elected are the ones that should be very involved in this decision. And what the AG has said today is that is the case. Now, I hope that they're going to consult very closely with Dr. Colquitt, Dr. Simmons, and Dr. Martin. I can tell you that after that meeting yesterday, I talked with Dr. Colquitt, and I can absolutely guarantee you that she had strong feelings and all the statistics that she felt like she needed to do what she did, and had the support of many of her colleagues in that. And so what I would say in all those situations is everybody needs to work very closely together. But the folks who need to be making the decisions on the schools, the opening of the schools, and how those schools should open are going to be making them. And so, they're not, and that's the way it should be. I shouldn't make them. I have been a school board member, and if I had been a school board member, that's what I would have said, that's my responsibility, and I would have wanted that responsibility, and now they have it.
So does this mean that school is back on in person for August 17th or whatever?
You know what that means is that the schools, those are the questions you need to be asking the school superintendents, the school boards. The school boards are who should be making this decision, as well as the boards for the private schools or whatever their governing body is. And that's just the way, under local control, that's just the way it should be.
That's what I was about to ask. From a legal standpoint, does this actually undo the county and local health authority's orders, or is this just an amicus brief?
No, I think what it does, and I think what I read in that or what I heard said, was that if there was an outbreak in a particular school, that the public health authority would have that authority to go in and to close that particular school down. But to have a blanket order that did that without an event occurring within the school was what the AG said was beyond their authority.
In other words, the choice now to go back to in-person or virtual goes back on local schools.
It's totally on the local schools, whether they be private or whether they be public.
One other thing I wanted to ask you about, we can ask Vinny more about this, but typically when he gives his briefings, he's been very cautiously optimistic when he talks about good numbers. But today he's using phrases like, you know, is this the end? There's things we're excited about. It seems like the data shows things the way we want it to go across the board. And are you getting that same sense right now?
I got that sense a little bit. We did have a last week where we had a number of deaths, and that was disturbing. I will tell you that I feel like that Dr. Colquitt and Public Health they're going to be very concerned about this decision with regards to the schools, because I think they do sense, or they have a real concern about there being an outbreak, a spike, or something like that occurring, and then those kids taking that home. But again, it's local control.
Good. Short and straight today.
Wait a minute, I got Channel 8, your absentee question.
Yes, it's William. So whether it's the schools or the masks or the closures, I mean, there's definitely been a lot of changes where decisions are made and reversed. I mean, I'm sure a lot of parents right now are feeling this frustration and confusion. Do you feel like the whole process, whether it's back or maybe the back, kind of the limbo that leaves people in?
I would tell you that I think that one of the reasons we got to the point of the Public Health Authority was the frustration that the schools were discussing as far as the changing back and forth of the TEA's policies. Basically last spring when the schools were closed, the state stopped sending funds to the schools. And if it had not been for the CARES Act, those school districts would not have been able, they would have been in a real financial bind. And that was what caused that same policy, if it had started again this fall, would have put the local school systems into a lot of peril. And that was all the way up until Friday the 17th, 1 o'clock, when the TEA came out and said schools could push it back 4 weeks and then boards could push it back another 4 weeks. Because prior to that time, the policy was if you're not open to the general population on August the 17th, you're not getting funds. So yes, the back and forth has been very troublesome for the schools. And then therefore, when they made the statements to the parents, it was again a back and forth. I'm hopeful that what was said today will stick to that policy and that the school boards will be able to make the decisions as well as the private schools make the decisions that their folks want them to make.
Thank you.
Thank y'all. Have a good day. So ask Gomez now. You're going to have the authority.
I just sent him a text to see if he wanted to comment. He said,
All right, y'all. Vinny's coming right now, so let's hold on to the phone here.
Obviously, Paxton disagreed with what he said yesterday.
Okay. Oh, yeah.
right back.
Yeah.
They're going to get parent reaction. They're asking if you can wait 2 minutes. So.
Okay. So Lauren just I thought she had a baby.
No,
No?
yes, she just did. That's why.
Okay.
She was.
I'm
good
pregnant.
job, that's why she was
Okay.
getting it.
Pick 'em in. Okay. Well, tell her congratulations. You know.
I'll let you do that. We'll record it.
Yeah.
Then I'll send it to her.
Okay.
Seriously.
Yeah,
Yeah.
the judge already agreed.
Yeah.
Yeah, Judge, you want to record it?
Yeah.
She'll get a kick out of this.
Yeah. Hey Lauren, this is Vinny Tanasia. Just wanted to congratulate you on your baby. Welcome to motherhood, and your world is about to be changed. I'm sure you're finding out. So again, congratulations on many sleepless nights, but trust me, they're all worth it. Enjoy.
She'll get a kick out of that.
I know. You know if it's a boy or a girl?
It's good.
Ah.
He is a little girl.
Yep. Oh. I'm sure you guys are too. Oh yeah. Running
Marathon day, right?
Oh, yeah.
Today was crazy because just getting here, I left, I was in Grapevine and since we were doing the pool thing on the inside, I left a little bit later to come here. There was a wreck on 121 that was so bad that it added 30 to 45 minutes.
Yep.
to that time. There's the two cars were just, I hope everybody was okay.
Yeah.
How are you?
Tired. Other than that, another day in paradise.
Well, you gave us some glimmers of hope today.
Yep. And to all my folks who were against us, but the only thing I can say is it was math. So I mean, what else did we change? Nothing.
Still don't like them.
Yep.
I know they're talking to that student going from Passport.
Sure, no problem.
Hopefully this is getting closer to not as many long days for you.
Well, no one's in sight right now.
Yeah.
But we'll take what we can get.
Has there been any updates on these vaccines that they've been testing?
Yeah, they just started a phase 3 trial. As you know, I think there was a lot of coverage yesterday. It starts this week. They're taking 30,000 people across the U.S., including in the DFW area. So.
And this is the one out of Boston?
No, whatever. The company's called Moderna. I don't know where they're based out of.
Okay.
But their vaccine is in phase 3, and that's the bigger trial. Then out of Texas A&M, they got a grant from the federal government, $265 million, I think. They're going to help produce that Novavax vaccine. Again, it's going through its trials, but the warp speed plan is like, let's just produce what we've got, and then figure out later which one actually works, and then we'll just distribute that one. Cut down on waiting for everything to be perfect before you produce it.
Right.
Let's just produce everything, and then whichever one's good, let's take it.
So let's get what we can.
Yep.
Now, I heard something about, did y'all talk about a West Nile case?
Yep.
Oh my goodness.
Yeah. Last week I came into court and I said, well, West Nile's looking pretty ugly, but no human cases. That afternoon, one case, and that was a death. First case of the season. Like, oh, great.
Jeez.
Yeah.
Well, hopefully that one won't get as rampant as it once was.
Oh, yeah. I hope not. Only so many things we can take. Come on.
But now that we got all these cicada killer bees around, and everybody keeps thinking they're the murder hornets.
I know, murder hornets. Oh, yeah.
Oh man, here we go. That's this area.
Yeah. So where do you live?
I live in Grapevine.
Oh, okay. Well, we're neighbors. I live in South Lake. So.
Okay, yeah. You're right down the road.
Yep.
I like that area a lot. It's the whole Grapevine, South Lake area.
Yeah, well, plus
West Lake.
the access to Irving. I mean, you know, lots of choices there. That's good.
Yeah, that's my wife bought the house before we got married, and she bought it because it was so central and it was close to the airport, and at that time she was traveling a lot.
Yep.
So
Where does she go to for travel?
she doesn't anymore. She was with a different company at that point. So now she's with the company that would like her to travel, but obviously.
Yeah. I know. Yeah, Lauren and I came from Michigan around the same time. Like I came in 2014, and I think she came around the same time. So and I was from the Detroit area, and she's like, "Oh, I came from Detroit."
Yeah, it's an area I haven't been to yet. I want to get up there. I want to experience the Great Lakes and all that.
Yeah, it's a nice little area. Like if you go and you really want to go visit like a nice scenic area, Western Michigan has a small town called Holland. And I would say go somewhere like in May. They have the Holland Tulip Festival.
Oh, yeah.
And it is beautiful. And the lake shore there is the most beautiful I've ever visited. Like the wind blows from like west to east. So when you go to Wisconsin, all of your beaches are like almost rocky because the wind is blowing into the sea and takes all the sand, and the rock is there. On the other side, the waves of course come, and then the wind blows the sand all the way to the in the sand, and it's like huge stretch of sand, better than what you see at the ocean. And you know, we have like sand dunes there, so you can do a dune buggy ride. I mean, you know, just get a four-wheeler that goes up and down. And it's just a fun place to visit. Small town, but just a tourist hotspot. It's really good.
Very cool. Yeah, I would definitely have to check that out. It sounds great.
Yep.
Love to go see that tulip festival.
Oh yeah. We just happenstance upon it. I'm like, wow, this is like we're in paradise, you know. And of course, I haven't been to the Upper Peninsula, what is that, Mackinac Island, whatever it's called. But a lot of golf lovers go there in the summer because apparently their golf courses are just immaculate.
Very cool. I like to play golf, but I'm not even good at it, so I don't travel for golf.
I know. I don't either. Yeah.
Yeah, it's, people who travel for golf, I'll give them it away, and nobody wants that.
Yeah.
Spend more time looking for the ball than anything.
I know, right? So what else is new?
Not much, just same old. Come in, get the job done, and go back. I guess my son got a new job.
Oh, where?
He's starting work at, he's 16, and he's his first job, and he's going to be working at Discount Tire.
Oh, nice. Yeah, well, that place.
Yeah, he wants to be a decent mechanic. So, anything with tools, he loves it. That's
Yeah.
what. Yeah.
Yeah, that's good work. They make a lot of money.
And Discount Tire's got some really good programs. They, the first thing they told me him was, if his grades start slipping, they cut his hours.
Right.
And they make sure that his school's more important. And then on top of that, they said if he stays with them through the duration of high school, they'll pay for part of his college.
Right.
So that's good too.
Do we have on the phone Lily, Joy, and who else?
Ariel, Valencia.
Remind me.
Well, she's always in Dallas, so you
Oh, I
know,
see. Okay.
she's, I think she's going to be filling in more for Lauren now that she's on maternity leave.
Gotcha.
Phoebe, are you not going to introduce me as Lauren's intern?
That's Lauren's what?
Lauren's intern.
Lauren's intern? No, you're far beyond internship now.
Your intern.
All right, Vinny's getting ready to start. Hold on. So I guess Lauren's intern is on.
That works.
Good.
No need to run. We'll wait
Thanks,
for you.
man, I'm sorry.
No, we're
Just
okay.
like a lot of people to get to today.
I understand.
Hey, are you okay, Warren?
Yeah, I'm ready to roll.
Hey, let me start by just asking you about your briefing, and I asked the judge about this too. Whenever we've seen changes in numbers, you've always been, I thought, careful
Yes.
in your assessment of those and cautiously optimistic.
Right.
I sensed more optimism out of you today.
Yes.
And seeing some of the trends across the board on multiple data points.
Yes, so that's what's exciting, right? I mean, we're seeing a decline in our data. The numbers are trending down in all of our indicators. So COVID-like illness was trending down for almost 3 weeks, but the other indicators weren't confirming it. And now we're seeing that confirmation come. And what I can tell you, the biggest factor in all of this is that for the last 3-4 weeks, people have been wearing these masks very consistently. It's out in the public. You go to a store, people are wearing it. And that was the big difference. Before that, I would go to a store, I'd probably be the 1 or 2 people that would wear it, and now it's the other way around. Only maybe one person doesn't wear it, and everybody else does. So it's really having an impact. So we're excited to see that just this little change is starting to show in our data. Now, I'm always worried about stuff. I mean, there's data reporting delays and glitches and all those type of things. You know, who knows what surprise may come our way. There's also conversation about the probable cases. So that's going to maybe change the picture a little bit, you know, because right now we're counting confirmed cases. And there are some probable cases showing up in our data. So once we look through all of that, it might change the overall picture a little bit, but so far we're excited that the trend is down, coupled with Texas as a state, starting to trend down. That's good news. And then at the national level, we're seeing a plateau. So all of those things combined are making me fairly optimistic that maybe we've come off a recent peak, and hopefully we'll see reprieve for a little bit. If we continue to follow good public health advice, we can probably drive this down further. If people get relaxed, well, then we're in trouble again.
Vinny, speaking of trends, if I heard that correctly, hospitalizations were about 12% now for occupied beds, right?
Mhm.
Was it at 17 at one point, if I heard
Yes,
correctly?
that was just maybe about a week ago. And so that was one big thing. I mean, we're kind of flattening out at the hospitalization level. There's a little bit of iffiness in the data because they just changed how they report information. But overall, it's looking more stable. I was real worried. What's happening in South Texas is really worrisome. Hopefully we don't get here in Tarrant County in that scenario. That's why I advise people, if you're going to go out, wear a mask. Otherwise, continue to stay home as much as you can. That's the best strategy. We've said this from the beginning. This is a person-to-person illness. You put more people together, you're going to have a problem. And if there is a situation where you have to be together, maintain a 6-foot distance, wear a mask. That's the best practice at this point.
Did you share the concerns that when the judge read the letter from the DA's office and mentioned local health authorities are still very concerned about the opening of schools? Did you share that concern?
Absolutely. Just what I said, if you put more people together, you're going to have a problem. And it's very hard to maintain that in a school setting. A lot of changes would have to be made to try to make a good effort to open schools safely. But we're very disappointed that the health authority order was sort of overruled, that this was not allowable or invalidated. That's very disappointing. I mean, they were asked to, make a decision for their community. Looking at current trend data, I think they made a very wise choice, a very wise decision. And to have that get invalidated puts us in a very tough situation on how to help our community get through this process. So certainly, advice remains the same. I've said this before, I'll say it again. Currently, online schooling is the safest option. It's the lowest risk option. After that, it is not a no-risk strategy. Risk is there. When you open schools, whether they're religious schools, private schools, public schools, doesn't matter. If you open schools and put a lot of kids together, there is going to be risk of spread. Are there ways to reduce that and mitigate that? Of course. There are ways to try to open them safely. But it's going to continue to have disruptions because there's going to be cases among kids, cases among teachers. So all of that is going to be very disruptive to learning, but we'll just see how all that pans out.
You guys all right?
Ariel, William, anything?
Yeah, hey, it's Ariel Placenski from Channel 8. Thank you for letting me ask over the phone. But you talked about during the commissioners' meeting about how the State Department, where they sent out that press release, that they're working to improve and change the way they report deaths. And I'm curious, on the local level, what are Tarrant County residents, what kind of changes are they going to notice now that the State Department is kind of going back and redoing how they do deaths?
So hopefully not any major changes at the local level because the State Department did clarify in their press release that they weren't expecting any changes to be made by local health departments in how we report deaths. Tarrant County, we're fortunate that we were already reporting deaths by the date of death. I think that's probably going to be the biggest clarification in how things are accounted for. Many health departments just report by the date they report. For example, I said last week we reported 50 deaths. But if you look on our charts, how we portray that information on our dashboard, it is by date of death. Because that's the more accurate way to present that information on how those deaths occurred in our community. And I think that's the biggest change that people are going to notice and why DSHS was looking to sort of clean up that information, because they wanted to be accurately able to show what's happening across Texas. And they were relying on reporting from a variety of health departments who may not be doing all the same things. So at Tarrant County level, I don't expect any major change. Now, for a while, it may look a little confusing. We might report, okay, we have 5 deaths, and they might only say we have 1 death. That might be a little confusion for a little while, but I think it'll all sort out in the end.
Got it. Thank you so much.
Hey, Vinny, it's William Joy with Channel 8. So the saliva testing, part of the reason behind that was, a quick turnaround time. We're still hearing from people with some of the other, like, standard swab tests who are waiting a long time for results. Have you seen any change in how quickly those results are getting turned around, and is there any sort of plan to expedite that moving forward?
So again, it's not necessarily the type of testing that we're doing that is making things faster or slower. It's just how busy the lab companies are. Generally, the lab companies that we're working with on the nasal swabs, they're big companies, right? Quest, LabCorp, CPL, many other big name lab companies that have huge capacities. But even then, because they're not large national labs, they're getting samples from all across the country. They're getting samples from Florida, Texas, California, all over the country. And there's huge spikes in cases in all of these states. So when you overburden and overtax the system with all of this testing requirement, you're going to find some delays. Should we get them quickly turned around in 48 hours? Absolutely. We want it fast. We want to know if we're sick or not, and we want public health to have that information so we can do the follow-up. But the reality is, it's just a mismatch between number of people needing testing and capacity available at our large commercial labs. Now, going back to the saliva testing, so okay, that's a different lab that has huge capacity as well, and because they're sort of new into this, right now the turnaround time is very, very good. We're seeing that average, I think, was about 30 hours last week, and the funny part is the test takers, the participants, they got the results faster than the public health department did, so that's great news. We're loving that. At least they got their own information on an app, on a portal. So that's great news that people were not having to wait on us to get the results and then inform them. The lab company did that. But again, as more and more volume picks up, is it going to sustain? That remains to be seen. As this type of testing becomes popular, can that particular lab handle such huge volumes? Again, remains to be seen. But so far, so good. We're excited. That's why there's an expansion. Now we have 2 locations instead of just J.P. Elder Middle School. Starting today, we also have at Dickey's Arena. And the big difference is that J.P. Elder Middle School is going to have the morning half. I think it's like 8 to 2 or 8 to noon. I forget the time. And then in the afternoon, from 4 to 8 p.m., we're going to have appointments at Dickey's Arena. And the idea is that it's going to allow people more time choices and location choices to go get this testing done, because certainly we want to make sure that there's no barriers for anybody who wants to get tested. And as people go back to work, maybe evening time frames would be more convenient when they come back from the office, and if they need to go get testing done, absolutely.
Can you give a quick update on the West Nile situation?
Yes. So, last week we had 1 case and 1 death with West Nile. It's very unfortunate. That's how we kicked off our season. In my briefing last week and today, what I was able to show was that we have a uptick, a very significant increase in mosquito activity, and especially mosquitoes that are infected with West Nile. So that data is mirroring, if you remember, 2016 was a pretty rough year with West Nile. That data is looking just like what we saw in 2016. So that gives me sort of deja vu worries that we might be heading into a strong West Nile season. And I know everybody's focus has been on COVID, so I want to keep reminding people, wear long sleeve clothes, make sure if you're out and about, wear DEET, the spray, so you can stay, protected against mosquitoes. And at your home, make sure you clean out any standing water, whether it's from the sprinkler system or just watering the plants. Wherever there's standing water, that's breeding grounds for mosquitoes. So take care of your property and yourself by protecting yourself, and hopefully we'll get through without having another virus to contend with. All right, thank you.
Yeah, let's just not go back to, what was it, 2012?
Oh, no, yeah, don't even bring that up. I wasn't here, but Man, when I came, that was not.
Man, that was,
Yeah.
that year was